we had a really nice discussion of the needs of the female player, injury risk factors, some of the gender biases perhaps within the game, which might be something we want to consider in future when talking about injury risk. And we proposed a rehab model for injury risk reduction and injury rehabilitation. And I spoke in particular about a phase which focused on biomechanics and neuromuscular re-education.
I'm really pleased with how it went. This was the first time for me talking about holistic health and different pillars of health you can impact in your clinic, and I didn't know how it was going to be received, but I think it was well received. I'm pleased that we're starting to see more people investing in long-term health behaviours and how we can change long-term health behaviours in a clinic.
Just finished a talk called Chill Out, which aimed to try and debunk the myths from the editorial in the BJSM on peace and love, and question whether ice actually is an anti-inflammatory agent. I would argue that it's not, based on the evidence actually cited in the editorial, which is all based on rats. And actually, we're not rats, we're humans. And if you were to translate what they're saying, they're basically icing a rat on an ice block whilst receiving an ice massage. That would be the same as you or I laying on a glacier in Norway receiving an ice massage. It's not really a fair comparison, and that's what I basically critiqued for the last 20 minutes.
And Kirsty shared the journey that she's been on, and particularly the kind of things that we've been learning about how we can manage this as a clinician.
Yeah, so I've really enjoyed the opportunity to be able to give some take-home messages to people. So things around if it's a mechanical pattern of pain, so if it doesn't meet that mechanical pattern, so your mechanism of injury is not matching those signs and symptoms, or if there's no mechanism of injury, you need to consider referring that patient. So, and when you do refer them, be persistent and be specific. Like what I was talking about was actually quite rare. Be aware of the fact that there are outliers. No, not everybody fits that common trend. So sometimes you need to be quite persistent when you refer someone and be their advocate.
I think one of the big messages that we had from today was to advocate for the patient. So even if the patient maybe comes back from the referral pathway, but you still have suspicions about something more serious or more sinister, then we still need to press forward with our knowledge as graduate sports therapists to make sure that we're advocating for that patient in that healthcare environment.